Assalamualaikum warahmatullahi wabarakatuh. My name is Azza Suraya binti Muhammad Dan. My metric number is 2019584319. My research title is Exercise and Obesity Management, a Bibliometric Analysis and Review of Systematic Reviews and Meta-analyses. The topic that I'm going to explain is the background of the study, statement of the problem, research objective, literature review, methodology, and also result. For the background of the study, first I'm going to explain what is obesity. Obesity is a complex disease involving an excessive amount of body fat where the individual body mass index is 30 or higher than 30. Someone who is obese has a difficulty to lose weight. Based on my research on exercise and obesity management, there's a few studies have indicated a link between exercise interventions and obesity management. Obesity is a complex chronic medical condition with a major negative impact on human health, where most of obese people are at the increased risk of many serious disease and health conditions such as hypertension, cardiovascular disease, risk of cancer, stroke, and etc. Based on my study, exercise is most likely to be effective when it is combined with diet because the amount of energy intake and energy expenditure is balanced. This can be proved by a series of reviews including a concurrence review that indicate an exercise induces weight loss, but the weight loss is even greater when it was coupled with energy restriction. Energy restriction, known as a calorie restriction, it is a dietary regimen that reduces food intake without incurring malnutrition. To conduct this study, a bibliometric analysis method is used. Bibliometric analysis is a quantitative method to determine the trend of research area by counting the frequency of certain keywords. According to Van Raan 2018, these methods are useful as they provide an assessment of research in a specific area over a period of time. Besides, based on the study of CC et al. 2019, this technique helped us to visualize the division of field into several subfields and show the relationship between variables. This new research technique can provide insight into evaluation of the main topic discussed in the field over the years. Thus, the aim of this research is to assess and map international research concerning exercise and obesity management using a bibliometric approach. Statement of problem. Through this research, there's a problem that can be identified. Obesity problem has increased worldwide and considered as a global epidemic by World Health Organization. To overcome this problem, a lot of study has been conducted. According to Collet et al. 2010, several research studies and reviews have found that regular physical activity and exercise are associated with successful weight management. However, despite the growing number of academic publications, initiatives, and reports in this area, there is no systematic analysis has yet been carried out on the large body of research in this area. In order to provide a clear picture of its evaluation over time, bibliometric analysis is a suitable approach to assess and map international research in regards to exercise and obesity management. Research objective. This study is aimed to focus on the following objective. First, to systematically analyze the current publication on exercise and obesity management using a bibliometric approach. Next, to systematically visualize the bibliographic coupling of publication related to exercise and obesity management from the selected indexing databases. Literature review. According to the study by OK et al. 2009, it stated that exercise is a proven modality for treating the disease of overweight because, according to Lett et al. 2018, exercise aids in decreasing the chance of cardiovascular and metabolic disease development, improve physical fitness and health indicator in obese individuals. This is because Increase in energy expenditure during exercise help to enhance initial weight loss and prevent weight regain. This can be proved by the research of Jacquesis and Otto 2006. Based on my research, there's three types of exercise that is suitable for obesity management, which is endurance, resistance, and high-intensity interval training. From the research by Rosenberg et al., it shows that vigorous intensity physical activity of at least 1 hour per week was associated with a significant decrease in incidence of obesity because the increase in energy expenditure. Based on my study, obese people who exercise regularly and do calorie restriction in their diet tend to lose weight faster compared to the individual that only focus on doing an exercise only. This can be proved from the meta-analysis of 493 by Miller et al., where this study have shown that people who diet and exercise maintain their weight loss better than those who rely on diet alone. This research framework, there are three types of exercise that is suitable for obesity management. The first one is endurance exercise, second, resistance exercise, and lastly is HIIT, high intensity interval training. For endurance exercise, it helps in enhancing the fat oxidation that occurs in the body and it helps in improving the insulin sensitivity. Next, for resistance exercise, there's a significant numbers of studies have shown that resistance exercise is associated with a decrease in fat mass. Besides, it also can help in improving the glycemic control and blood lipid profiles. For high-intensity interval training, it helps in optimizing the fat oxidation that helps to induce a negative energy balance and help to decrease the body weight. Methodology. For research strategy, the time frame is 10 years, which is between 2010 until 2019. There are two types of database are used in this study, which is Scopus and Web of Science. For the search keyword, combination of free text terms, which is exercise and obesity management. Next, Prisma is a preferred reporting item for systematic reviews and meta-analysis. Next is bibliometric data. At the article level, as can be seen in the online supplementary materials, several bibliographic elements were gathered, such as the number of citations per article, author's name and their affiliations, publication year and country, citation record, author's affiliations, and etc. Strategy for data synthesis. Two pieces of free software were adopted in this study, Publish or Perish and BOS Viewer. Publish or Perish was mainly used to conduct the descriptive analysis of publication and citation structure of search publication. BOS Viewer is the tool for visualizing similarities of the bibliographic item. The similarity represents the connectedness of articles published in terms of co-authorship, citation, co-occurrence, and bibliographic coupling. So here is the data collection and analysis. This is a tabulated data in the spreadsheet program. This is a search queries in the Publish or Perish. And this one is the retrieval queries in the BOS Viewer. Data collection and analysis using Prism is to identify exponential trend by using nonlinear regression plotting. Result. Distribution of document types in WAS and also Scopus. From the table, it shows that the number of article, review, and meeting or proceed production in Scopus is higher than Web of Science. Scatter plot showing the numbers of articles published in Web of Science where exponential fitting of the data revealed an increase in the number of articles written between 2010 to 2019, and the highest publication recorded is in 2019. Publication volume for Scopus. Scatter plot showing the numbers of articles published in Scopus, where exponential fitting of the data revealed an increase in the number of articles written between 2010 to 2019, and the highest production is recorded in 2019. Citation impact diagram shows the total number of citations in Web of Science and Scopus from 2010 to 2019. In Web of Science, the maximum citation is in 2011, where the total number of citations is 14,450 and the minimum of citation is in 2009, which is 2,349 of total citation. In Scopus, the maximum citation is in 2011, where the total numbers of citation is 47,736. Meanwhile, the minimum citation is in 2019, which is 7,488 of total number of citations were recorded. Author's productivity. In Scopus, Warden TA was ranked at 3 with total of TP, which is 51, but has the highest CPP, which is 115. In WAS, Astrup was ranked at 7 out of 10 authors with total of PP is 20, but has highest CPP, which is 48.88 among other authors. Next is author influence. In Scopus, Astrup is the most influential authors, but in Web of Science, Astrup was ranked at 7 out of 10 influential authors. Journal source. In Scopus, Obesity review journals only produce 200 of papers, but the total of citation is 9,655, which is higher in the rank. Meanwhile, in Web of Science, the journal that rank from 7 to 10 is the TP is less than 100. Next is country-wise analysis. In both databases, United States has the highest rank with total number of citation in Scopus is 142,818. Meanwhile, in Web of Science, it only has 58,778. Leading institution. In Scopus, University of Sydney only produced 209 of paper with total number of citation of 10,633. Meanwhile, in Web of Science, Pennsylvania Commonwealth System of Higher Education produced a total number of production of 351 and the total number of citation is 8,493. So here is the main keyword cluster in Web of Science. Next is the main keyword clusters in Scopus. In both databases, not more than 40 keywords has been chosen. Discussion and conclusion. The result of this study suggests an upward trend for both in the number of publications but downward trend for citation impact. Top 4 in the country-wise analysis are dominated by the same country in both databases. The publication year with the highest frequency of paper was on 2019 in both Scopus and Web of Science. Furthermore, the fact that exercise effect on obesity management have been considered by specific research disciplines suggests important research field specific variations. So here is the references. Thank you.